There are some things in life we would rather not want to experience. Maybe it's a root canal, maybe it's a car accident, or maybe it's another Real Housewives of whatever on television. All right, I actually think I would like that. Trust me, I'm a huge fan. Add to that list, diarrhea. Diarrhea sucks. Well, in today's video, we're gonna talk about your favorite subject, diarrhea. Cha-cha-cha. We'll talk about what causes it, what is the difference between acute diarrhea and chronic diarrhea, and at the very end, we'll talk about when you need to worry about your diarrhea. Guys, let's literally talk about food. Howdy y'all, Dr. Islam here, aka your Poop Guru, trying to give you the best tips and tricks so you can live your best life from the top all the way down to the bottom. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my newsletter where you get great tips and tricks going to your inbox every single week. Now, diarrhea is a digestive condition which can cause loose and watery stools. It is certainly annoying, but it can also be a sign of something else going on inside your GI tract, a symptom of another disease. Now, most people have diarrhea at some point in time, not a big deal. Hey, even yours truly has the occasional diarrhea. And these bouts are typically acute with no complications whatsoever. So acute diarrhea or short-term diarrhea, typically less than 4 weeks, is usually not that big of a deal. But chronic diarrhea, more than a month, can lead to serious complications and can be a sign of something else going on inside your gut. Let's talk about the differences. So once again, acute diarrhea typically is defined as diarrhea less than 4 weeks. And in most instances, it's either due to a food poisoning or an infection. And usually it's pretty obvious. All of a sudden you have this, whoa, I gotta go! The sense of urgency, having to use a restroom, where before you were having pretty normal bowel habits. You may have other symptoms, bloating, pain, some cramping, but by and large, it's mainly just diarrhea. Now, there are a lot of causes of acute diarrhea, which you'll notice is either due to an infection or maybe some sort of food poison that you have. These include things like a bacterial infection, a virus infection, some sort of food intolerance, let's say dairy, for example. It could be a parasite that enters the body. It could be a reaction to certain medications that you're taking, or it can even be due to recent antibiotic use, which changes the gut microbiome. So how exactly do you treat diarrhea? In most cases, all you need is just supportive care. You don't have to do a lot. Fluids, resuscitate, have more of a bland type diet, and in most cases, it will resolve on its own. In some individuals, we may need to give you fluids, or we actually may need to give you medications or antibiotics to get rid of a bacterial infection. But for the vast majority of people, not a big deal. It will self-resolve and you'll go about your normal way. So what about diarrhea that doesn't pass longer than a month? That is called chronic diarrhea, and that is a completely separate category than acute diarrhea. Now, chronic diarrhea is more of a serious condition, and this is either a response to something going on inside the GI tract, or could be a symptom of another disease that we have to find out what is going on. The symptoms of chronic diarrhea obviously are diarrhea as well, but you may have different symptoms that are different from acute diarrhea, including weight loss. You have diarrhea that wakes you up in the middle of the night. Maybe it's really painful. Maybe there's blood or there's a spasm in your rectum that you feel. Maybe you feel nauseated, have some vomiting as well. They're more global symptoms than the typical acute diarrhea. So what are some causes of chronic diarrhea? One of them is inflammatory bowel disease like Crohn's or ulcerative colitis. Or maybe it's an autoimmune disease like celiac disease or some sort of other issue like that. Or it could actually be food. Sometimes if you have the same foods that cause acute diarrhea, it'll also cause chronic diarrhea. So for example, artificial sweeteners or gluten or dairy can make it seem like chronic diarrhea, but if you have it all the time, that makes it longer than the 4 weeks. It could be medications, including non-steroidal anti-inflammatory medications or ARBs, angiotensin receptor blockers. These are very common blood pressure medications. It could be you have diabetes, which can also affect your GI tract, or it could be another autoimmune disease. So what do you do if you have chronic diarrhea? Well, initially what we will do is that we'll get stool testing. We'll just make sure we're not missing anything obvious. We may check for some blood testing as well. Make sure you're not anemic. Make sure you don't have celiac disease. Maybe even check your thyroid. Sometimes we'll get imaging to see what's going on. And sometimes we actually may have to take a look with the scope to take a look inside the GI tract, maybe take some biopsies to get a better idea of why you're having chronic diarrhea. So how exactly do we treat chronic diarrhea? Well, we do the same things for acute diarrhea, give you fluids, resuscitation. Sometimes we'll give you medications depending on the cause. Sometimes it may be lifestyle changes, dietary options, or we may have to give you something stronger than that depending on what we think is going on. Now, there are certain lifestyle changes that do help out with chronic diarrhea. This includes things like eliminating or minimizing caffeine or alcohol, minimizing or eliminating dairy or artificial sweeteners, having food that has a lot of plants and fiber in them, drinking fluids from preventing dehydration, and obviously stopping medications that we know could be causing your diarrhea. So here's my call to action to you. Obviously, you may know if you have chronic diarrhea. If you do, don't wait. Come see someone like me to see what we can do to get your diarrhea taken care of. We can do testing, we maybe do imaging, maybe we'll take a look with the scope, but I bet you we can get to the bottom of it. Ah, yes, pun intended. If you enjoyed today's video, don't forget to check out this video where I give you 5 tips on what you can do today to help manage your diarrhea. Well, thank you for watching. Don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my newsletter where you can get great tips and tricks like you're learning in today's video. Guys, and thank you for watching. Don't forget, let's talk about poop. Thanks, everyone.